Now, it's time for today's perspective. And the question for perspective today is, are we any closer to a total cure for cancer? Well, that under discussion at what is the world's biggest cancer conference, the American Society of Clinical Oncology's annual meeting, which has just wrapped up in Chicago. New insights given into treatments, detection as well. Also warnings, of course, that despite the advances, there is still much work to do. Well, we're going to talk here on set to Professor Antoine Italiano, who's just back from the conference himself. He's medical oncologist and director of the precision medicine program at Gustave Roussy Hospital here in Paris. The hospital actually took part in 107 presentations at the conference, and Professor Italiano himself spoke about antibody drugs. We'll discuss that part of it in just a moment. But thanks very much for coming in and talking to us today. I mean, before we talk about the conference, let's just talk more generally about the problem. Despite all the advances, cancer is still obviously a huge, huge problem around the world. It affects millions of people, either directly or indirectly, of course.
Yeah, absolutely. Cancer still remains the first cause of death, particularly in Western countries. And so the cure rate is about between 65 and 17%. So we still need to do a lot of progress to improve the cure of this group of disease. Yeah.
The conference itself, not just about treating cancer according to the organ where it starts, but increasing according to biology. What does that mean?
Yeah, so basically, to better cure cancer, we need to better understand how cancer cells can proliferate. And so now the majority of the progress we do is based on a better knowledge on the biology of the tumor. So, and this helps to develop what we call the new targeted therapies, actually. Yeah.
And in fact, targeted therapies, I mean, what it means, doesn't it, that some of those really, really difficult cancers that are very difficult to target can now be targeted?
Yeah, absolutely. So one of the great achievements we saw at the last meeting in Chicago is the development of a new drug in pancreatic cancer, which is probably one of the most difficult to treat cancer. And at the meeting, there was a presentation about the results of a new targeted therapy that actually inhibit a gene which is called KRAS, which play a very important role in the progression of pancreatic cancer. And so the results were quite meaningful. Based on this new drug, we are able to double actually the survival of the patient with pancreatic cancer. So it's a great achievement. Yeah.
And of course, the big cancer, perhaps the most cancer that gets talked about more than any other, is breast cancer. Advances there as well?
Yeah, absolutely. So the cure rate of breast cancer is actually now very high. We cure about 90% of the patients with breast cancer. So now research is more focusing on how we can improve the quality of life of the patient and how we can improve actually the side effects. And so some key results that were presented in Chicago were about the implementation of genomic tests to help to refine actually the way we treat the patients. And so one study demonstrated that based on a genomic test, we are able to identify a group of patients for whom we can actually spare chemotherapy and treat them only with hormonal therapy, which has a much less side effects than the standard chemo.
So people who are listening to this, you've mentioned pancreatic cancer, you've mentioned breast cancer. I mean, there are always continuing advances, aren't there, for people who've been affected by these treatments? I mean, does the level of hope increase more and more and more for people who've been affected?
Yeah, absolutely. It has a huge impact. And what is important also to know is that I am a clinical researcher, and all the research we do, we do that in collaboration with patient advocacy groups. So patients help us also a lot to design what are the best clinical trials we can do to improve their outcome. Yeah.
Let's talk about your own speciality. You talked at the conference about personalizing antibody drug conjugates, or ADCs. ADCs becoming a new real pillar of cancer treatment. Explain to us what that is, how it works.
Yeah. So ADC actually represents probably a new revolution in the way we treat cancer. So far, one pillar of the treatment was chemotherapy. which is basically a kind of poison that is given to the patient to kill cancer cells, but they kill cancer cells in a non-specific way. And so this is the reason why we see a lot of side effects, hair loss, vomiting, etc. Antibody drug conjugates represent targeted chemotherapy. These are antibodies that target specifically the tumor cells and not the normal cells, and they help to increase the concentration of chemotherapy in the tumor, and they help to spare the normal tissue. So basically, we increase the efficacy and we decrease the toxicity.
Still a lot of work to do on that, though?
Yeah, still a lot of work, because this class of drug is increasing. So we are developing new targets, new cytotoxic drugs, and so probably this new class of drug will replace in the next few years the standard chemotherapy we are currently using to treat the patient.
And how do you go from what your research is telling you to actually being able to target these, to make these drugs available to people? Because that's another step, isn't it, presumably? Once you've done the research and worked out new ways of doing things, you then have to be able to actually give those treatments to the patient.
Yeah, so this is another big problem, which is related to the access of innovative therapy. I have to say that in Europe, we are probably less efficient than in the US to provide early access to the drug. So we have to work in collaboration with patient advocacy groups to convince the regulatory authorities to have these drugs available and reimbursed for patients. Yeah.
There's so many different facets to it, isn't there? I mean, obviously there's the detection of these things, then there's the treatment, and there's also the aftercare as well. I mean, I noticed that the Society's outgoing president, he spoke at the conference saying he wanted to talk more about grief, focusing on the subject of loss. I mean, that's another issue as well, that perhaps not enough is being done to try and help people who are affected, either themselves or their families.
You mean in terms of
in terms of care for individuals once they're receiving treatment?
In terms of, sorry?
In terms of care for people once they've received like mental health.
Yeah, mental health. Yeah, it's a very important aspect, and I would say it's at least 40% of the treatment. So the drug is very important, but the care, mental health, means also a lot. And so we are doing a lot of efforts. It's what we call supportive care to improve the outcome of our patients. Yeah.
I started off right at the top with perhaps a bit of a naive, typical journalist type question about, are we ever going to get a cure for cancer? Of course, it's much more complicated than that. It depends on what type of cancer you're talking about. But do you think we will ever get to the point where cancer will become much, much less of a problem? I mean, are things advancing at the stage where cancer will perhaps not disappear, but will become much more of a minor issue?
I will be a little bit less optimistic about that. Unfortunately, we see an increase in the incidence of some cancer, particularly in young adults, and particularly in digestive cancer. So this is probably related to the environment, the food. So there is a lot of progress in developing new drugs, but I think that we have to do much more in terms of prevention and in the modification of the habits of the people in order to modify and to decrease, actually to prevent, which is a key word, to prevent the occurrence of cancer in citizens. Yeah.
Good to have you with us on the programme today. Thank you very much for coming in and talking to us. Professor Antoine Italiano, just back from that conference in Chicago looking at cancer and, of course, what can be done to try and, if not eradicate it, at least make it much less of a problem.